Welcome to another episode of The Worthy Physician. I'm your host, Dr. Sapna Shah-Hawk, reigniting the human spirit and your passion for medicine. September is a month where we look at suicide prevention and awareness. September 10th was World Suicide Prevention Day, and September 17th is National Physician Suicide Awareness Day. It's a sad reality and needs to be talked about. Physicians are humans, as we have families, we have friends, we have so much love and passion for what is a beautiful profession. Many of us, the purpose and the reason why we went into medicine was because we wanted to make an impact in the world, in our communities. And currently, the U.S. healthcare system is at a crux. And this is where I believe moral injury comes into play. But currently, the system puts profit before people with the insurance denials, prior authorizations, lack of reimbursement. These decisions are being made by entities that have never been in the exam room with the patient and is really diluting the patient-physician relationship. But I'm going to ask you to push that to the side. I would ask you to list out, why did you go into medicine? What is your purpose? What are your core values? We've covered this in other episodes, such as sitting down with Daniel Wren. And why do I bring this up? Because at the core of what we do, we have ethics, we have a drive. Again, medicine is a beautiful and noble profession. But many times, because of the strain, beauty can be lost and diluted. Part of suicide prevention and suicide awareness is also taking care of our own physical and mental health. The reason why I launched this podcast was because I lost my best friend to suicide in 2019. If you find that you are struggling, reach out. Reach out to a friend, a colleague, your physician. You matter. You're replaceable at work, but you are not replaceable at home. There is only one you. Resources. Call 988. Reach out to Physician Coach Support. Join Physicians Anonymous. These links will be in the show notes. It's open to physicians, medical students, residents, to help battle the stigma. Start with your local medical societies. In this episode, it should have been number one, the whole reason why this podcast was started. I sit down with Dr. Peg Bicker, not the physician, but her surviving husband, her widower. His name is Larry Schwarm. She was in his life for 22 years, and as a close friend and colleague, she was in many of our lives as physicians in the Sedgwick County area for over a decade. She died by suicide in the early hours at the end of June 2019. Suicide is something that plagues the physician community. It goes undiscussed, or at least it is not openly discussed as it should be. So for the next 40 minutes or so, really concentrate on this story that Larry and I dive into. So the reason why I've asked you to come on this podcast is because, well, Peg's death was actually the catalyst for this podcast. And I'm taking a very slow approach about what is physician burnout, things that we can do to help ourselves as physicians, because it's very well known that the system has to change. Like, the system has to change because what we're doing is not sustainable. And I believe that the pandemic really has brought that into the spotlight even more so, with the lack of healthcare professionals, the lack of staffing. You have doctors that are retiring early. You have doctors that are cutting back their hours like I have. And then you have physicians that take their own lives. I mean, almost one a day. And that's huge.
Oh, that's really depressing. How many out of your class have taken their own lives? Do you know? I mean, and I know there's at least one I know of that it wasn't direct, but it basically starved herself to death.
Right.
And I think that was, in a way, that's suicide, whether it's intentional or not.
I would agree. And if I am not mistaken, I believe it's 3.
There was one during school, as I recall.
Yes. A young man.
Okay. And that was out of a class of what?
I want to say about 120.
Yeah. So pushing 3%.
Yes. Yes. One was during school, and 2, including Peg, Dr. Bicker, after residency. Her death really made me, it shook me at my core because of her being a colleague and one of my closest friends, among other things. And I just think there's too much professional repercussion for being human. And I think there's so many barriers as a physician that we cannot ask for help. We can, but it affects us.
There's repercussions if you do.
Yes. Every year when we go to apply for a license, we have to answer a questionnaire, which are we being treated for depression or anxiety? Now we have since at this Kansas level, we have gotten that changed on October 31st, 2019. And it was through some of our colleagues at KU that really approached the Board of Healing Arts. And so it's rephrased as to, I'm paraphrasing it, are you being treated for X, Y, and Z, and does it impede your ability to practice medicine? And I think that's huge.
That is huge. I hope Peg was part of that.
She was the reason for that.
Wow. That's wonderful. I didn't know that. Well, I know that you're aware of the letter. She didn't leave a note per se, but
now
I don't know what I could have done if I had known. Peg being Peg, she would have refused treatment, I think. And if I would have forced it on her somehow, she would have probably had a very hard time forgiving me for that.
I don't think there's anything anybody could have done.
Well, it took me a long, long time to get to that conclusion, but I think so.
You and me both. But unfortunately, that is not an isolated case as far as if anybody, like when I went to apply for disability insurance, I had a stint in medical school where I quit going to classes, and it was not necessarily depression. I just didn't want to be in class with the way it was structured, right? So I withdrew and then I re-enrolled, and that's when I met Peg. And so I was now part of the class of 2010 with KU. And the way that they restructured it, they cut out a lot of unnecessary lectures and then really focused it on about 3 to 4 hours of lecture a day and then alternating labs in the afternoon. Otherwise, it was 8 to 5 every day. And I don't think a human can function that way. Maybe others can, but I could not. So I went to talk to a doctor about that at KU. They diagnosed me with depression. I said, no, I'm not depressed. I just don't want to do this type of training. Like to me, this is not a good quality of life. When I went to apply for disability insurance, when I started as an attending, and not only that, but being female, that also increases my premium compared to a male counterpart. If I were to have, it's nuts. But then it also affects life insurance, which that's just, we're held to incredibly high standards that I don't think many other professions are, maybe clergymen and pilots and lawyers, and I understand. But in a profession, I think where we're acting as healers, we're going to encounter a lot of things that hit us at a personal level and really shake us to the core.
And who would you want more than your own family to be of good mental health than your own physician?
Right.
You don't want somebody that's suffering internally and can't express that, trying to help you.
Exactly.
Yeah. Well, we got that solved.
Peg took her own life. She died by suicide. You are her surviving spouse or widower, and it's been a little over 2 years. How have you coped with that loss, Larry?
Probably every way possible. I was completely, utterly devastated. I had no idea that it was happening. I knew that she was stressed, but even the night that I took her life, she seemed okay. And she went off to work, and she said she's going to pull an all-nighter because she was closing her practice and she had a week to get some records straightened out. And that was not unusual in our life. When she gets working on a project, whether it was before med school, it was an art project, and during med school, tests coming up, she could easily go 24 hours without sleeping. And I called her several times through the night. Last time I talked to her about 1:30 in the morning, she still was putting on the facade. Everything's fine. Don't worry about me. And when I woke up in the morning and found her dead, and there's no way to describe it. And everything after that for weeks was sacred. I couldn't touch her eyeglasses or her toothbrush. And I kept trying to figure out what I could have done. And was there any part of this that was my fault? Why didn't I see it? I should have been a better husband, just anything at all. And, I'm going to say, I don't know how long it was, but I would think of her 100 times an hour probably. And then pretty soon it was a few times an hour. And now it's a few times a day. So, it just gets better and better. And I've gone through all the stages that Kubler-Ross says that we go through. And I was fine. I'm not going to do that, but I did it anyway, whether I wanted to or not. I was angry at her at some point. Look what she did to me. You couldn't cope with it, so you dumped it in my lap. Well, that's not fair. I mean, I know that was absolutely not her intention, but and then I felt immensely sorry for her. And I've come to, and I'm sure it's going to evolve probably for as long as I live. There's going to be changes, but I've been at a plateau for a while where I am really, really glad I knew her. And I had her in my life for 22 years. I am sorry she left, but that was her decision. And I know that she didn't do it lightly, and She didn't do it vindictively, and she just couldn't cope anymore. So I feel very sorry for her. I will always love her.
Absolutely. I really liked Reggie's message at the celebration of her life. I think one of the last lines that he read, and he wrote it, was that medicine did not deserve Peg. And I think that is very true, because as much as I love medicine, I like practicing medicine. It's brutal. It is very difficult to sometimes find the joy in life and really remember why somebody initially went into medicine. They meaning just medicine as a whole, the training from day one in medical school through residency, try to mold you into somebody that's going to say yes to everything. Really, really push your identity into conforming, and really pushing your personal boundaries.
Peg was maybe an idealist, but she did this because she wanted to be the best physician possible, and she wanted to make people's lives better. And it seemed to me that the system just put up all sorts of roadblocks to keep her from being able to do what she was really good at. I wrote a couple of things down. The first was about seeking mental or emotional help. One of the things that she wanted, from day one, she wanted to have a private practice.
Right.
She didn't want to work for a big group. She wanted to be able to really have a relationship with her patients. And her dream was that she would be in business long enough that she could, see them through their lives. You pick them up as a younger person and see them into old ages. And, but there seemed to be just a financial penalty for caring about people. And maybe not caring is not the right word, but be a caring person that took the time to examine all aspects of a patient's concerns. When she took over the private practice, when she purchased a private practice from a retiring physician, right away, she started finding, misdiagnoses or things that had been done incorrectly, or maybe they just were outdated. But she always looked at things not from an algorithm like, oh, got this, it has to be that. But she'd do that, but then she'd also say, but it could be. And she'd look at it from a different direction. And I think this is part of what made her such a good artist as well. So she would spend, if somebody had concerns, she would spend half an hour, 45 minutes, an hour with people, and she got reimbursed for the equivalent of 10 minutes. That's what Medicare gives you for that.
Yeah.
Whatever code that you put in. So she wasn't making enough money to cover her overhead. And then the paperwork, which you're all so aware of, it was just overwhelming to her. And to spend, even when she spent that much time with the patient, it would take her an equal amount of time to do the paperwork. And if she did them on a quick rotation, like she needed to do to make some money to cover her business, the paperwork would take several times as much time as actually seeing the patient. And that's not doing the patient any good.
No, I agree 100%.
And it's me bitching because that was one of the things she just could never get over. She got behind on paperwork the first week she was in practice, and she never, ever caught up. And it was always this black cloud hanging over her. We can't go on a vacation because I need to be working at the office, but she couldn't work at the office because she was depressed. And so,
when did you see that start to spiral out of control?
I'm going to say she had to practice for 5 years, and she worked for somebody else, one other physician for a year before that, or better, not quite a year, but at any rate, out of control, I'd say about 2 years into her owning that own practice, when she just kind of realized that she was never, ever going to catch up, and has started weighing down on her. And also she ran out of money.
Wow. That part I did not know.
And I wasn't happy about it, but I kept saying, just close, walk away from it. Look, we can make this work. But she couldn't let go. Things always had to be perfect for her, which was great if you're a physician, but it's not good if your life's spiraling out of control and you can't fix it. He couldn't. I don't think anybody could have fixed that practice. The doctor that was there had been there 30 some years, maybe. Well, actually, I'd even closer to 40, and he was grandfathered into a lot of things that Peg wasn't allowed to do when they changed rules. It's from this point on, and so a lot of he called them cash cows, went away. His equipment was outdated, and he still had film X-ray, and she started being penalized for using film. And so every time she took an X-ray, she lost money. She also, being the kind of a good doctor that she was probably one of the handful of physicians in Wichita that saw her own patients in the hospital. She did rounds. And
on top of clinic.
Yeah. So she just worked herself to death, and she felt like she was just being beaten into the ground and not being rewarded for it. And most of her patients, an overwhelming majority of the patients, I have no idea, 99% of them thought she was wonderful, but she'd get one letter from somebody or a phone call that somebody was upset at her, and it just would devastate her. That's all she could think about. And that got worse and worse as her self-esteem went down.
I can understand that. And I think as a physician, and I know Peg's personality and our training, we trained at the same residency program. We really were trained to have a systematic approach, but also, again, keep in mind for X, Y, and Z, a very broad differential diagnosis of what it could be and how to approach that one thing at a time. But also, like what you said about that's what made her such a good artist. And mind you, she was, like you said, she was an artist before she became a physician, was that she could look at things from multiple perspectives. And that is the way we were trained. And you put so much effort, and it's not for the money, right? It's like what you just said. that one letter from a patient will just devastate you because you gave them everything you had.
Oh, yeah.
And that's where the system needs to change. It's not only, we're not herding cattle. This is not an assembly line of patients. Peg loved to treat the individual. And she was a very compassionate human being, physician. And when you have a system that says that this is the type of healthcare we want to deliver, but does not pay you for your time and your expertise, that's a problem. Electronic medical records hinder patient care, and they are actually very, very big part of the burnout because physicians are spending double the time now. Instead of seeing patients, we are more documenting. Paper charts were just fine. Larry, besides what we've discussed briefly, how does the system need to change? How does healthcare need to change to help physicians, help other healthcare workers? How do we prevent burnout?
That's kind of above my pay grade, but the things that we've been talking about are things that need to be changed. And I think from my perspective, I was saying what I saw, and you seem to be agreeing with me. The paperwork, the insurance reimbursements, and the complexity of all of that, and the coding and the quota system, that if you're working for a practice, rather than, of course they want you to give the best possible practice, but they also tell you have to see X number of patients during a certain time period. And how do you justify that? I need to spend more time with this person. If I spend more time with this person and more time with this person, I could get fired for doing my job.
Right, because it all comes down to everything that we do is tied to an RVU.
Mm-hmm.
And that RVU has a cash value. And so that's how they kind of come up with that calculation. But it's crazy because we went into medicine to hopefully make an impact positively on a patient's life through health. And sometimes it is spending that extra 20, 30 minutes holding their hand, because you can't just walk out of the room if they're having chest pain, or if they're having suicidal ideation, or if they're having a panic attack.
She was really good, and I got this from some of her patients, but she seemed to be really excellent at putting people's mind at ease. And we had friends who, I can think of one in particular. Her sister was in the hospital for an emergency. She's going to have an operation. There was an obstruction. And her sister called Peg and asked her to come over and explain what the doctors had just said to her, because it was all doctor speak. And Peg went in and she drew pictures and she held her hand and she explained exactly what they were going to be doing and how that's going to fix the problem. And I think, and other patients would say, when I left her office, I came out feeling so much more, not better physically necessarily, but better about the way that I'm feeling, because I understand what's going on.
Yes.
And I know that when she was doing residency, some of the attendings would ask Peg to go in and talk to the family and explain, something more serious, is tell them that mom's dying, because you can do it better than I can do it.
That is correct. She had a very, very gentle demeanor. She had a way of explaining things in regular, plain English. She would talk to the patient, not above the patient. And she had an amazingly calm demeanor.
She did. At home too.
I can't imagine her any other way.
Yeah. Saw her mad maybe half a dozen times in 22 years.
Wow.
Well, I'm like, mad. She might be disappointed or something, but saying that was that she was so caring. I quite believe that she took her own life knowing that, not only me, but her family, her sister that she loved dearly. It devastated so many people. And that was a point where I was feeling like she'd been really selfish when I was going through that stage, which I don't so much anymore, but because she was such a not selfish person.
Absolutely. And it's just, there's a big hole in the medical community because of her because of her death. I know there's a big hole with you.
So is your just a blog? Have you done some before? Is it going to be like the initial one, or how's the work?
This is going to be the initial one. Yeah, it's so I started the website back in April, May, did a few podcasts, just my own ramblings.
Mm-hmm.
And then I brought on Dr. Bob Bean. He's a physiopsychologist. We used to work together at the VA, and we discussed physiology. So I brought on a physiopsychologist to talk about physiology and burnout and what that looks like, and also talk about nutrition and burnout. There's some evidence that, nutrition can help. Now, it's not the only treatment for depression and anxiety and burnout, but there are some studies to suggest that by changing the way we eat and the types of food that we eat, it can decrease anxiety and depression, and even some evidence that it might help with burnout. Of course, that is not the answer, and I'm very open about that the system needs to change.
Oh, yeah. Well, that was another symptom that it's so different when you're living with somebody and it happens gradually. You would have been witness to this. I think she probably was anorexic for a while. And I was really worried about it. I mean, I cooked for her and I gained a lot of weight because I just made everything as fattening as possible on desserts. And she'd take one bite. No, I don't feel like it. I should have seen that was she's depressed. I didn't realize it. That's what happens again. But if it ever does, I'm gonna recognize it for what it is. But,
I mean, looking back at the photos, she really did change over 11 years.
Yeah, it was kind of shocking to me too. I mean, I've done it before, but in some ways, maybe she didn't die as young as I think she did, because she went through a lot of aging really fast.
She would always jokingly say it was that trip to Costa Rica.
Yeah, that was one.
But I think that's also
I just lost weight on that one.
She said she came back with parasites.
She did. I did. Well, and we both took the parasite medicine, and I really had. I mean, how we found out, I was having terrible stomach cramps and things, and I went to see one doctor, and I told him that we'd been, and he sent in a fecal sample, and it came back negative, and I went to see another doctor in Kansas City, and he punched around on me and couldn't find anything. And 2 nights later, I had to go to the bathroom. I a ball of worms. Egg was absolutely fascinated. Came out. I said, I've never asked you to look in the toilet. I'll go look in the toilet and tell me what you see. And she was like, oh, give me some tweezers. I got to get some samples. But we went, I don't have no idea what the medicine was. We went to Walgreens. She called the doctor, and he called in a prescription, and zip zap. A couple of days later, everything was fine. And she took them too. She also had, what was it? Was it chicken pox once? Turned out to be flea bites. She could be a little bit of a hypochondriac.
Larry, do you have any final thoughts?
Oh, well, I ran into somebody about a year ago, said they were going to go to med school. And I said, oh, please don't. I'm pretty bitter about it. I'm glad their doctors are around, because if I need them, I want them to be there. But that's not a final thought. I miss her. I wish it wouldn't have happened.
But how can you promote a profession that took somebody so dear away?
No.
If there are any physicians that listen to this, what do you want them to know?
Pardon me?
If there are any physicians listening to this podcast, when it gets published, what do you want them to know if they're struggling with depression, anxiety, or suicidal thoughts?
Oh, what I'd like for them to know is, for God's sake, seek help no matter what the repercussions are. Your life is more important than any kind of penalties. And by not seeking it, you could be doing a lot of damage to yourself, and you could also be doing damage to your patients. How can you be a great doctor if you're carrying around such a burden? And fight for your rights. I know that's easy to say and impossible to do, but.
Well, and I would say, if anybody listening to this, if you need a physician to stand with you, I would, because we as a profession have to fight for our rights to be in a humane medical.
No, I haven't. I haven't. Certainly a lot of them I have not been exposed to, but I've never been, in my limited exposure, I've never seen anything quite like medicine. There's almost this boot camp mentality about particularly residency, which seemed pretty unnecessary. I don't know if there's an option for that, but it's cramming a certain amount of information, but at some point it becomes counterproductive to just work somebody to death. They don't absorb it. And I know it's teaching only to work under stress, which they're probably going to have to do at some point. But I'd actually, if I were designing it and just the way that I saw it, and I know there'd be pushback, I'd have the residency be longer with humane hours. And along with that, I think there needs to be some professional training, about the business of being a doctor, not the mechanics of being a doctor. I'm assuming, and this is just based on Peggy's experience, but she didn't have any idea how insurance worked, other than what she'd pick up, from being on rounds and things. And I think was one of the mistakes that possibly she made, and it wasn't a mistake, but it was her decision. But it might have been good for her to be on a practice for a couple of years, so she could have learned that before she tried to go out on her own. So she might have taken that jump a little too quickly, but she was determined, so that's what she did.
Oh, I agree 100% with you. I do think that is logical, that is reasonable, and it would be nice to have that business background and that training within residency. And I think we would have better retention of physicians staying if not just residency had that approach, but also the profession of medicine. I don't know how we change that. I know it's at the structural level. I don't even know where to begin on how to do that, but I would love to see that change within my lifetime. And if it doesn't change, I would highly discourage my 2 kids from going into medicine, just because I don't want to see them go through what Peg had to go through, what all of us had to go through. But also, it's not humane. And the statistics, 1 physician a day, and female physicians are 2 times more likely to be successful at suicide.
Well, female physicians are, you say?
Yes, sir.
Well, and physicians are probably very high percentage, at least, and percentage of them are successful in general. They know exactly what it takes to kill themselves.
But Larry, thank you for coming on this, and thank you for your time. I know this is not easy for you.
Well, not, but it's also a little bit therapeutic. So thank you for having the concern. I would like to think that something good could come out of Peg's death.
Trying to make that happen. If you have found this episode helpful, click, subscribe, share it with a friend, because we can all use camaraderie.